Hi, welcome back to my YouTube channel. I am Dr. Fatima. I'm here to educate patients as well brainstorm with fellow colleagues on how to issue quality healthcare services. Kindly subscribe, like and share so that everyone can benefit from this knowledge. In this video, I would like to talk about seeking a second opinion or a third or a fourth. What do I mean by this? For instance, you visited a doctor and you have done some investigations and you are diagnosed with a certain disease, and you need to go to, there's some further procedures that are needed, or you need to, there are some recommendations that might have been given to you and all that. You don't really have to accept immediately what you have been diagnosed with. You have a right to seek a second opinion. You can visit another doctor elsewhere in a different hospital, in a different county, a different country, and present the same complaint, let them do some workup on you and get to hear what their diagnosis would be, if they will derive to the same diagnosis or if the diagnosis will differ. It's very essential, it's very important, so that once you decided to go by the recommendation, then you will be able to commit fully into those recommendations and you abide by them. What am I trying to say is that the quality of healthcare differs from one hospital to the other. The experience of medical personnel differs from one hospital to the other. Sometimes, as a doctor, in my experience, I have been presented with lab reports which were kind of alarming. The patient was concerned and all that, but when I decided to redo the blood works in our hospital, the reports differ, and the patient was not found to have to be going through the diagnosis that they had been diagnosed earlier in a different hospital. There has been some incidents as well whereby someone came with complaints, and in those complaints I was able to diagnose the patient with a certain disease which they were not diagnosed from a previous hospital where they had visited. So these things happen, these things are there. I would really urge you, before you decide on something, just upfront, get to hear what the other doctor will say, a doctor from a different hospital. You can decide to do this in two ways. You can present the reports there, or you can literally go there fresh and let that present your complaint and let that doctor or medical personnel attend to you afresh, and see if that personnel will be able to derive back to the same diagnosis as you were diagnosed earlier, or if they would be able to diagnose you with something that was missed earlier. These things are very important because initially, I've seen cases, I've witnessed cases